29-year-old Anna suffers from neurofibromatosis. Since she was a child, a painful tumor has been steadily taking over one side of her face. She says her appearance was so shocking, it scared young children. 4 years ago, she began a series of risky surgeries to remove the 2-pound tumor from her face.
When you look at yourself now, and when you think about where you were 3 years ago, you feel like everything you've been through has been worth it?
Yeah, I feel it's been all worth it. My dogs never treated me any differently. I suppose because they don't really know. I feel a lot more confident now that I look in the mirror. A bit more resemblance of a normal person, of being more social and just wanting more things in life. Being in public now is completely different. I've learned to not shut people out. I'm more friendly to people. I don't see them as a threat like I did before. I've learned it was better for me to let people in and not hide my feelings. It was a big step for me. It took a lot of years to accept myself, but I am who I am.
Anna is here. So do you feel like you can live a normal life now?
If people would stop judging me or by the way I look, I think I could.
Why did you want to tell your story?
Because I want to let people know there's help and let parents know not to shelter their kids or people that are older, not shelter themselves from, society. Because that's not the way to live.
It's not the way to live. Well, after several doctors said that it was just hopeless, Dr. Manish Batra took on Anna's case. He and a team of surgeons performed the plastic surgeries at Scripps Memorial Hospital in La Jolla, California. Anna's operations were made possible by his charity, D.O.C.S, called Doctors Offering Charitable Services. Come on up, Dr. Batra, let's talk to you. Welcome, welcome, welcome. How did you first hear about Anna?
Well, she was brought into our office, and when I looked at her for the first time, I was completely just amazed that she hadn't had help up until this time.
Is it genetic, NF?
It is. It's genetic, and it's passed on, from parent to child.
So one of her parents had it?
Yes.
Yeah. So would she automatically pass it on to her children if she were to have children?
Yes. There's a very good chance. About half it's a 50% transmission rate, so there's 50% chance it would be passed on.
So you wouldn't want to have children because you wouldn't want a child to grow up the way you have?
No, I wouldn't. I wouldn't want to have them go through that, what I did.
And were you surprised that she was so shut down?
Not at all. When you look at the way the tumors that manifest themselves, you can't help but understand why this person wouldn't go out in public. Such a big part of our identity is our face.
It's how we look.
Yeah.
Yeah. Well, thank you for being the kind of person that you are, to start an organization to do this for people, D.O.C.S.
Yeah.
Wonderful. Thank you. Thank you, and thank you. Thank you. We'll be right back. We'll be right back.